Hello, my name is Ashley Moore, and this presentation is for TED 494. It is on fetal alcohol syndrome, and it's for students in particular who have fetal alcohol syndrome. What is fetal alcohol syndrome? The Mayo Clinic defines this disability as follows. Fetal alcohol syndrome is a condition in a child that results from alcohol exposure during the mother's pregnancy. Fetal alcohol syndrome causes brain damage and growth problems. The problems caused by fetal alcohol syndrome vary from child to child, but defects caused by fetal alcohol syndrome are not reversible. Fetal alcohol syndrome, also known as FAS, is a preventable birth defect that is seen in about 1% of all births in the United States. Fetal alcohol syndrome is a broad disability. There is a spectrum that each student with FAS falls on. It's referred to as the Fetal Alcohol Spectrum Disorder, FASD. Children on the fetal alcohol spectrum need intervention, accommodations, guidance, and resources to guarantee that they receive quality education. There are different parts, more serious and less serious spectrums. The first is explained as it's just FAS, and it's the most serious diagnosis with a complete triad of disabilities in terms of prenatal and postnatal growth, as well as facial and central nervous system disorders. Partial fetal alcohol syndrome incorporates some facial characteristics and other features, or growth or neurodevelopmental disorders. There's also alcohol-related birth defects, and there's also alcohol-related neurodevelopmental disorders. There are many defining characteristics of fetal alcohol syndrome, although most are invisible to most people. There are physical and also unseen or internal. The physical is a very thin upper lip and smooth skin between the lip and the nose, usually a small nose which is upturned and small eyes. A lot of the times there are malformed fingers, toes, or ears, and then there also is a small head that characterizes this disability, and that's because of a small brain size, because of the brain damage, which is an unseen thing, such as vision and hearing loss, the central nervous system, as well as social problems and behavioral problems. The characteristics previously listed are what contribute to the classroom characteristics that are displayed in the classroom. This can affect judgment, problem solving, coordination, learning, and memory. Students can have poor social skills, which can cause inappropriate or disruptive behavior, and they can have trouble staying on task or sitting still or quiet for long periods of time. But educators need to remember that students on the fetal alcohol spectrum require patience and persistence. All the possible symptoms make school in general very difficult for students who are on the spectrum. Early diagnosis is recommended because by adolescence, all the facial features can change and it can be hard to tell that a student has fetal alcohol syndrome. And for assessment, there are different steps. You will need a referral, and this will allow the student to be seen by a number of professionals such as doctors, psychologists, and this will help them decide if they need a diagnosis for this child. There's also testing, but testing includes IQ tests and individual achievement tests, but these tests do not take into account behavioral or social problems. A student can achieve high scores on the IQ test, but they can have so many problems with social and behavioral that it just doesn't add up. A student should be thoroughly assessed in all categories to ensure that their intervention is effective. Family involvement can give a great deal to assessments because they can provide special insight. They know the child or student way better than anybody else does. Classroom considerations and modifications include acknowledging and modifying the environmental stimuli, because school can be the biggest challenge for a student with fetal alcohol syndrome. School is designed and set up to developmentally match the specific understandings and behaviors at each age. And the students who are on the fetal alcohol spectrum, they usually fall behind the mark at each grade level. So it's really not set up for a child with a disability. You can create visuals, and this is great. You can label areas of the room. You can create a schedule that's color coordinated. You can label bins and supplies. This will all help a student be able to find things and also move around the classroom, and they'll be able to visually see things, and it will help them a lot. You need to provide a quiet space. This will help calm down a student. This can give them their space. A teacher should also adjust their expectations. No two students are the same, and they should never be compared with another student or expected to behave a certain way. No child is the same, which means there is no set timeline for how these students should be acting or progressing. A teacher should also create a positive and understanding atmosphere. They should instruct other students to be helpful, respectful, and let the child who has fetal alcohol syndrome know that they are wanted and they are welcome in the classroom. And if a teacher can utilize small group instruction, this will help greatly because they'll have more time and more energy to help a child with fetal alcohol syndrome go through the day and do different tasks. And if you can really utilize small group instruction, you'll have more one-on-one time with the child. And you should practice social skills every day and use any conflicts and inappropriate behavior as learning opportunities. This is really important. They can learn from mistakes or situations that really aren't appropriate for school. And also, you should build a trusting relationship with a student and their family. If you have an open line of communication, this really, really, really helps because you can communicate with the family and they can communicate back to you and let you know maybe something different that you can try. There are support services and additional resources. This includes the school support system with the IEP. A student should receive counseling. The special education teachers that come with the IEP, teacher aides can be a big help, and if there's a resource center or a room in the school that that child can go to during the day to receive additional support, that's wonderful. A child with fetal alcohol syndrome can also receive therapy, occupational, physical, speech therapy. Occupational therapy will help them practice, self-care and ease the stress that comes with everyday activities. Physical therapy can be used to gain muscle tone and help a student's posture. It can help with fatigue and increase strength and develop gross motor skills. Speech therapy can help them communicate effectively, communicate their emotions. Tutoring services are also available, and there's a plethora of online resources. But there are countless online resources, which means that students and families, they could be overwhelmed. So an effective teacher could put together a list or a website of all these online resources that are the best for the family and the child. And these are my resources that I used in the PowerPoint. I really found all of them very helpful. The Mayo Clinic, I suggest anyone who has any questions about any disability, go to the Mayo Clinic. They have wonderful resources on pretty much everything. And that is my presentation. Thank you everybody for listening. I hope you learned a lot.